So there are many causes of dry eye, and if you look at population studies, it's actually incredibly ubiquitous or very common actually in the population. For many people, this isn't a problem, that as we get older and other environmental factors or changes in lifestyle, etc., take place, then it can become more problematic. Often it's because people struggle with the condition and they don't really know where to turn to, or it gets picked up by an optometrist, for example. It is really important if people suffer from dry eye that they seek help and try and establish why they may have dry eye in the first place. And in addition, whether there's any other serious underlying eye conditions or even systems affecting other parts of the bodies that could actually be causing this. And your eye care professional is the best person to address that. In most instances, dry eye is not a serious condition. However, for a minority, either because the dryness itself is very severe, putting one at risk of infections, for example, or because it's associated with some more serious underlying medical condition. And therefore, again, it's really important to try and get that looked at as soon as is convenient and by an eye care professional. Dry eye condition can lead to other conditions. As we mentioned, in severe cases, it can result in reduction in vision for people. That can pose a risk of infection, for example, or in some patients, it can result in scarring of the cornea, the window of the eye, or sometimes less commonly as well, formation of new blood vessels into the cornea, which is something quite serious. So again, the sooner that it can be looked at and addressed, the sooner that the type of dry eye can be established and the right treatment can be initiated to try and prevent more serious complications. There are some natural remedies that can be applied to treating dry eye. I explain to all of my patients that it's not one thing that will make it get better, including, for example, using artificial tears or tear substitutes. It can, for example, include using lid massage to try and get rid of some of the oily secretions that get trapped, more commonly cause dry eye. It can also be associated with conditions that affect hormone imbalances, for example. And so some patients, in later life may require hormone replacement therapies, for example. Additionally, we know that dietary requirements, and in particular, lack of omega-3 in our diet can be an important factor in dry eye for some patients. And so either a more balanced diet or in some instances supplementation can help in the treatment of the condition. So in addition to some of the dietary contributions to dry eye, for example, lack of omega-3, which we find in oily fish, for example, modern life where we live in more air-conditioned environments or where we stare at screens for prolonged periods in a day, all can contribute to make dry eye worse. And so rehydration, taking breaks from screen use, for example, can all be practical things that people can undertake to try and help with their dry eye condition. So dry eye often requires multiple inputs to try and improve it. First of all, we need to try and establish what the cause of dry eye is, and that might include, for example, substituting tears, either because they're not made or more commonly, they evaporate too quickly. For many people, dry eye caused by imbalances in the oily glands in the lids, and this can include using, for example, lid hygiene and hot compress to try and improve the surface as well. Some patients require other types of drops, for example, the use of steroid drops, as we now understand that the dry eye is an inflammatory condition, but over the longer course, there are other alternatives to steroids to try and help improve the inflammatory condition. Sometimes as well, we have to use tablets to try and help restore some of the imbalance because of inflammation in the eye. And in less commonly, there are other treatments available, including sometimes laser or surgical intervention in less common circumstances.